Welcome to this short webinar which sets out to explain the purpose of the summary narrative and how it fits into the Foundation portfolio and curriculum. My name is Fiona Cameron and I'm Chair of the Foundation Assessment Working Group. Next slide please. The UKFP Foundation programme is designed to provide a broad range of experiences in clinical practice in both primary and secondary care in a range of clinical settings. These experiences will provide the Foundation doctor with a range of clinical encounters which they can use as evidence of completion of the Foundation professional capabilities, which will in turn allow them to demonstrate the higher level outcomes. Next slide please. This slide shows the concept of Miller's pyramid and the hierarchy of evidence referred to frequently in the curriculum. For each FPC, we would anticipate evidence from each level of the pyramid. It should be noted here that for HLO1, we'd expect to see several SLEs linked to each FPC to ensure curriculum coverage. We would expect the Foundation doctor to ensure that each FPC has both physical and mental health FPCs recorded and linked. Whilst there is no specific number required, it is essential that the Foundation doctor and their supervisors are content that each piece of evidence submitted meets the requirements of the HLOs. Next slide, please. So why do we need the summary narrative? The rationale behind the summary narrative is that the Foundation doctor will review their learning progress and ensure that they have the required range of evidence. As a consequence of the reduced burden of assessments and having removed the minimum numbers of SLEs, the Foundation doctor and their supervisors will need to be confident that the HLOs have been met. The summary narrative allows the Foundation doctor to write a supporting piece that will explain to the educational supervisor why they have selected the evidence they have for sign-off. It will allow the educational supervisor to understand the rationale for the evidence provided. Next slide, please. The practicalities of writing this summary narrative are simple. Each HLO will require a 300-word maximum piece that explains the rationale for the selection of the evidence provided. Next slide, please. Ideally, the Foundation doctor should start writing each summary narrative towards the end of post 1 to help them critically appraise their progress and help inform their PDP for subsequent posts. The educational supervisor will be able to review this progress. Each HLO 1, 2 and 3 will require a summary narrative, so that will be 3 summary narratives in total for the training year. Next slide, please. The content of the summary narrative is not summative, i.e. it's not pass-fail. However, having 3 completed summary narratives in place by ARCP will be mandatory. Next slide, please. What is the purpose of the summary narrative? In addition to signposting the supervisor to the selection of evidence, completing the summary narratives will help the Foundation doctor evidence HLO3, which is the doctor as a lifelong learner. It starts the lifelong process of keeping up to date with the doctor's learning and development and critically appraising their knowledge and skills to meet the GMC's requirements for revalidation. Next slide, please. Thank you for listening to this presentation. A fact sheet is available for both Foundation doctors and supervisors to review. Thank you.